Magandang umaga po sa ating lahat. Welcome to Decalogo, a joint governance lecture series by the Department of Interior and Local Government and the Development Academy of the Philippines Graduate School of Public and Development Management. This webinar series is in collaboration with the Philippine Society for Public Health, Society of Family Physicians, and the Philippine Society for Public Administration. I am Lizan Kalina, your moderator for this webinar series entitled Confronting the Present, Facing the New Normal, a Knowledge Co-Creation in Local Governance Amidst COVID-19. Before we start, there are a few reminders flashed on your screen. First, kindly turn off your Zoom audio during the discussion. In your Zoom profile, please reflect your full name and agency. Third, please write your questions in the chat box. Questions will be entertained during the open forum. Fourth, please answer the online webinar evaluation form found at this link as flashed on your screen. After the open forum, you will be able to claim your e-certificate and copies of the resource speakers' presentations. And lastly, we will capture a group photo at the end of the webinar. So for this episode, we will discuss the importance of surveillance and contact tracing, especially at the local level, using public health strategies. Okay, so the importance of this webinar will give us a few insights on public health strategies during a pandemic, the epidemiological tools that can be used in the local governance, surveillance and data-driven contact tracing, and public health best practices. We will be enlightened by our resource persons and experts from the Philippine Society of Public Physicians and from the Senate Committee on Health, and also from a local chief executive from Ormoc City. To start with, or before we start, I would like to acknowledge our participants via Zoom, FB, and YouTube Live. They are from different government institutions, private institutions, universities, and colleges. And also we have colleagues from international universities, Universitas Indonesia and Thammasat University in Thailand. Good morning to all of you. So to start with our discussion, let's hear a few words from Yusek Malaya, Undersecretary of the ILG. Yusek, are you there? Okay, I think wala pa si Yusek. So let's now proceed to our first resource person. Our first resource person is Dr. Lester Sam Heroy. He is the president of Philippine Society of Public Health Physicians. He will share with us how to co-create public health strategies in the face of COVID-19. Dr. Heroy is a public health specialist with more than 10 years experience at the community, sub-national, national, and international levels. He is engaged in various national and international organizations such as World Health Organization and United Nations International Children's Emergency Fund. Dr. Heroy, good morning.
Good morning, Dean Lizan. Good morning, everyone.
We cannot hear your audio. Kindly fix it, Dr. Heroy.
Yeah. Can you hear me now? Can you hear me? Hello?
Okay, there are, okay. I think you have difficulty in your audio.
Hello?
Can you hear us, Dr. Heroy? We can hear you still.
I can hear you.
So according to Dr. Mike, you can hear Dr. Heroy. All right. Okay. So please proceed, Dr. Heroy. Thank you.
I am going to share my screen now. Wait a bit. I was able to share my screen earlier, but this time I cannot. Can somebody share my presentation?
Okay. Let's ask Celine. Celine, can you please share the presentation of Dr. Heroy. Okay, there you go, Dr. Heroy. Please proceed.
Okay, good morning, everyone. Thank you for this time, and thank you for inviting me to present public health strategies in the face of COVID. I am Dr. Lester Heroy and representing the Philippine Society of Public Health Physicians. Next slide, please. Next slide, please. So as we begin, I'd like to us to reflect a bit some questions that we want to learn and we want to think about in this presentation. Before February and March this year, very few people know about public health. And then all of a sudden, WHO, all of a sudden countries actually declared public health emergency. So, the word public health all of a sudden, became part of everybody's vocabulary. So what is really public health? What are the core functions of public health? And how are these functions, public health functions, how important are these in a surveillance and response? And what are we doing in the country? What are the unique features in Philippine public health that influence how we respond to COVID-19? So these are some of the questions that I want us to tackle in the next maybe about 15 minutes of my talk. Next slide, please. The next slide shows actually just my background, and just to share, um, from medicine, after graduating in medicine about 15 years ago, I worked in Mindanao in Malaysia.
Inaantay na tayo sa CBA.
And also I was able
Inaantay na
to
sa
work
Kabha.
in a few other regions in the country through different experiences and through different assignments. I have also worked in other countries, and in particular in the Philippines, many of you can actually remember Ondoy, Typhoon Ondoy, the big floods, Typhoon Yolanda, Typhoon Sendong, in Iligan and CDO. So these are some of my experiences. And so this presentation is more or less a quick view of all these experiences and what public health is doing. I'm also teaching in UP Open University, as mentioned. Next slide, please. Next slide. So the next slide actually shows the timeline of COVID in the Philippines. And as I think as most of us know, as early as January, there were already a few tourists in the Philippines who were found to have COVID. And the country already did something to trace them and see where they went and so on. And then fast forward, early March, the government declared a public state emergency. And a few days after that, we started enhanced community quarantine in Luzon and so on. So this is more or less the story of COVID in the Philippines. And right now we're already on this towards the end of the second month and trying to see if our efforts were effective. Next slide, please. So the next slide is actually just a definition. What really is public health? And there are several definitions here. They are very more or less similar. And I underlined some of the words which are protect, to these are some of the words that I'll be also using in my presentation. As you know, it's basically preventing disease and promoting health. Next slide, please. So I would like to focus our attention on these 5 core functions of public health and how all of these are important actually in the response to COVID infection. Number 1 is disease prevention. We have health security, health promotion, primary care, and community engagement. And if some of you are taking notes, these are just among the these are basically the 5 things that I want you to understand and to take down notes. Just leave everything else. So these are the core functions of public health. And next slide. Next slide also shows health system strengthening functions, which we in public health field also do. So these include service level allocation, health workforce, access to medicines and supplies, health information systems, and monitoring and evaluation. So again, if you're taking down notes, these are also the other five things that I want you to remember. And these 10 actually public health and health system strengthening functions are the key points in this short talk. Next slide, please. Next slide. But I cannot go into the details. I'll just browse through everything, and these are actually being done. Everybody of us has memories of immunization when we were kids. So immunization is one of the important disease prevention strategies. We also have nutrition. We have nutrition month. We have breastfeeding programs. We promote it. Um, and nutrition for children, we have safe water, sanitation. All these are disease prevention methods that public health is using, and we still do these in pandemic response. Next slide, please. The next slide is on health security. So this is very much linked um, to COVID preparedness and response efforts. And included in health security is our disease surveillance and disaster risk reduction. Disease surveillance usually includes contact tracing, detection, and management. And in the COVID pandemic, actually, this is the part which is everybody's talking about, and everybody, all of a sudden appreciate the role of disease surveillance. There are also many movies on disease surveillance, movies on pandemics, on outbreaks, on epidemics, and so on. Related also to health security is disaster risk reduction and the management of emergencies and disasters. I think almost everyone has a memory of Typhoon Yolanda, Typhoon Ondoy, and all these things. So these are part of the health security roles and functions of public health. Next slide. So the next slide and next slide, another slide. This slide actually simplifies, it's a simple, very simple version of disease surveillance system in the Philippines. So even before COVID, in fact, I think since the 80s or in the 70s, um, the Philippines already has a disease surveillance system where we collect information from barangays, from cities, from municipalities, and send them to provincial offices, regional offices, and the national, the Department of Health. This is a very simple version, but it can get really complicated. And in the early phase, actually, of COVID-19, this is the system that actually was working while we were all still, working and going out. So it's already there, and it's in place. And it happens actually every day as things happen. Next slide. And another slide. So that was disease surveillance. An important function also of public health is health promotion. I listed some of the activities that we do for health promotion. Do you know that actually the water in your houses, the water in your buildings, um, even when you're in barangays, in municipalities, in rural areas, water testing is actually done to make sure that you are in a healthy and safe environment. So that's part actually of health promotion as well, to ensure safe environments. For many of us who were kids or teenagers in the 1990s, we remember this guy, Yossi Kadiri. He's one of the best example of health promotion in the Philippines. And every day, actually, you see the Department of Health. There is the Department of Health. Uh, they release information on the status of COVID-19. So that is actually risk communication that is being done. And health promotion is one of the main provisions of universal health coverage that has been put into law last year. Next slide. So the next slide actually shows primary care, our primary care facilities, which are the RHUs, and community engagement. Um, these centers, I think most of us have visited already our health centers, and everybody knows already right now who are the BHERTs, barangay health emergency teams. But before the BHERTs, we already have BHWs. So these are some of the core functions also that we have in public health, which is primary care and community engagement. Next slide. So I have shown you these 5 core functions of public health: the disease prevention, health security, health promotion, primary care, and community engagement. Next slide. Next slide shows you the next part, and I will also briefly just show you these other functions in health system strengthening that are actually more challenging. Service level allocation, we have health workforce, supply chain, health information systems, and M&E. So these are very challenging and also requires a lot of work, not only at the national level, but also at local levels. Next slide. And these 5 functions are actually very important in COVID response. So service level allocation is the idea when we try to assign specific services at specific levels of health facilities, from barangay level, barangay health stations, to hospitals, to big hospitals like regional health centers, and we make sure that there is a referral system. Service level allocation is very important because we cannot provide everything everywhere. So we have to allocate them efficiently. We cannot have like CT scan in the RHU, for example. We have limited resources. But then, so we try to, put a schedule, put an allocation so that people know where to go, and those who need more care can go to the next level. Next slide. So that is service level allocation. Next slide is health workforce. So in public health, go back please. In public health, we try to ensure 2 slides back. In public health, we try to ensure, one more slide back, please. Okay. So in public health, we try to ensure that we have the sufficient number of health workforce in our facilities. And the health workforce, next slide, please. The health workforce actually has been always on the news. So we see the challenges they're facing. They lack PPEs, many issues they have. In fact, many workforce dying. An important concept in public health is surge capacity. We have to make sure that, when something happens, there is a surge capacity in terms of workforce, in terms of medicines, and so on. And if you remember, early in March, there was a call from DOH hospitals, DOH agencies, that if you are a nurse or if you're a doctor, you're free, you can apply in order to help in COVID-19. So it's one of the strategies that we do to ensure that services are available and health workforce are available. Next slide. And we know the challenges in health workforce. Similarly, we have lots of challenges in medicines and supplies. And medicines and supplies, making sure they're available is difficult actually. As you can see in this slide, it's a long process from manufacturing to registration. Most of the medicine supplies, PPEs, vaccines, test kits are all included here. Many of them are actually imported and they have to be registered. And for medicines, they have to be listed in the national formulary for them to be procured. And once they're procured, we have to also make sure that these are accessible and people can buy them or can avail of them for free. So pricing is also important for medicines and supplies. So it's a long process, and I cannot describe actually all the challenges in each step. But all the more in the COVID response, it becomes challenging and problematic. And one of the advantages of the declaration of the state of calamity is to help local governments and governments um, make this more faster, make the procurement faster for medicines and supplies. Next slide. So the next slide shows health information systems. And I think many of the discussions today will be on how we monitor and how we evaluate health information, healthcare. So in terms of health information, there actually it's health information is at different levels, So when you go to hospital, you have medical records. Right now, we receive announcement in our cell phones to download this or to download this certain app so we can register. So it's part of health information. And at the city, at the province level, they also monitor the or track the status of COVID patients, the status of the PUIs and PUMs and so on. So health information is an important part actually of all these in order for us to understand what's going on. And we track not only, health, we hear about like how many people died, crude death rate, how many mothers or babies have died. So we monitor that, but we also monitor things like bed capacity. We monitor things like how much the LGU spends for health. Other things. We monitor stock outs of medicines and supplies in hospitals. So these are part of monitoring and evaluation that we do in public health. Next slide, please. So I have shown you, next slide. I have shown you some of the important aspects of public health functions and roles. Go back, please. Go back one slide. And there was a slide that shows the different public health. Okay, so this one. This slide shows the different public health institutions in the Philippines. We hear a lot about DOH, also PhilHealth. There are other institutions. And an important institution that we always mention are the local governments, the RHUs, who are actually our first line of security, our first line of protection. And in terms of public health, they are the ones in the communities, in the barangays, and in the field. So these are important public health institutions. Next slide. This next slide, I'm actually at the end of my presentation. And this is to emphasize that, yeah, those are the general 10 roles and functions of public health and health system strengthening. But in the Philippines, we have unique ways actually how to do it. And let me just mention these three important characteristics of Filipino public health. Number one is decentralization. Number two, we have a very strong principle of people power. And number three, we have a strong private sector. So I think for many people in government and in the health sector, we know that we are actually decentralized. Although DOH, PhilHealth, and national government can make rules, policies, and regulations. Actually, our hospitals and our local governments, our mayors, our governors, they can actually come up with public health measures in their own locality. There are many challenges in that, and it's not perfect, but there are also benefits. In fact, cities, provinces with resources can come up with really good programs way ahead of national programs. The Philippines also, we have a very strong people power, um, social participation, civil society participation in general, and not only in health actually. And it's one of our strengths, the people power principle that we have. And so sometimes, even though, when things happen, um, NGOs, civil society, schools, anybody can actually, come up, organize, and come up with things to help everybody. Um, there are also negative parts to it, like people can communicate and criticize and point fingers on certain agencies, but there's also a really good side to it, and we're one of the countries actually that's a very strong civil society, even professional societies. No, they work together to come up with guidelines and so on. So it's part of our strong people power sense. And finally, we have a strong private sector. So it's almost 50-50, public private, um, and private sector can actually do a lot of things as well. There are also disadvantages to having a strong private sector and so on, but that's beyond this lecture. So we just imagine that these three things, decentralization, people power sense, and the strong private sector actually play also in how public health response is done to COVID. And it has benefits definitely, but it has challenges. And the challenge actually for all of us is to just focus on the positive and how we can work together. Next slide. Yeah, so these are the 10 things that I talked about. And for those of you who are making notes, these are just the core functions of public health and health system strengthening. And for those in local governments or in local hospitals or RHUs, basically these are the things that are already being done even before COVID. And our doctors, our MHOs, our city health officers, PHOs, and even our local government officials, executives, are actually doing this daily and facing all the challenges in these core functions. Next slide. So with all those core functions that we know, the Philippine Society of Public Health Physicians actually came up with a toolkit to help guide local governments uh, in how they make decisions. Next slide, please. Yeah, to help guide local governments in how they make decisions. We also, I think for many health workers, professionals, scientists, LGUs, we are already trying to track also what really happened to COVID. Like, have we really flattened the curve? And so we also try to track it. And then now we have a lot of information to show us actually where we are. So this is actually from a website that was also prepared with the support of PSPHP, and we're trying to track. You can see the website details here. And next slide, please. I think that's my last slide. Thank you very much, and I think it's a challenge, and we're entering now a new phase in our country where we're trying gradually to lift our restrictions, our ECQ restrictions, and trying to see how we can normalize things. But basically, public health core functions and roles have been there even before COVID, and we're doing our best also to continue these and strengthen these in the light of the COVID pandemic. Thank you very much, and over to Dean Lizana. Thank you.
Yes, thank you very much, Dr. Heroy, for sharing us the key points on public health, especially on the core and health system functions. These really spell out the framework on health governance, but at the end of the day, what's really important is community engagement, for us to be empowered. The very reason why we have this knowledge co-creation, because we want to empower people to have a healthy community. And I really appreciate when you raised the Filipino Way public health framework. It's about decentralization, people power, and strong private sector. Government alone can't do it. So we really need the non-government organizations, the civil society organizations, and the private sector as well. But really, at the end of the day, we have to go back to the question, for whom is public health? And it's really for the people. So the center of development. Thank you very much for that, Dr. Heroy. Now let's proceed to our second resource person. Our second resource person is Dr. Aguedo Troy Hepty IV. He is a public health consultant of the Senate Committee on Health. He will discuss with us how to leverage new technologies in pandemic response. Dr. Hepty's consultancy work has been mainly on emerging infectious diseases such as SARS, avian influenza, MERS, and Ebola. He is currently working with the Senate Committee on Health under the chairmanship of Senator Christopher Lawrence Bongo. Dr. Hepte,
Yes, good morning, Dean, and to everyone.
morning.
I'll just ask for my next slide. Okay, good morning, everyone, again. It is a pleasure to join you today. I'll be using my hat as a public health epidemiologist and give you an overview of what our team, the Philippine Society of Public Health Physicians, and 101 Health Research have developed over the course of these past 2 months. Yeah, next slide, please. I'll begin first with a short review of what emerging infectious diseases are. This will be followed by general concepts in disease surveillance, and I'll then be introducing afterwards what we call our proposed pandemic response playbook and what it is about. I'll then take some time to discuss how contact tracing has been done and what kind of enhancements can now be done with predictive analytics. Afterwards, I'll briefly wrap it up with a discussion of how we can maximize new technologies for outbreak detection and the implications for improving further our COVID-19 response. Next slide, please. So, can you click on the slide again? It has a figure, yeah. During the past 30 or more years, it's almost parang 40 years na yata, we had a lot of emerging infectious diseases all over the world. So in the Philippines, we actually had some experiences in SARS. For SARS in 2003, we had a multi-country outbreak, which also affected the Philippines. And if you remember, in 2004 and 2005, we had this vicious outbreak of meningococcemia in Baguio, in the Cordillera region. In 2009 and 2010, we had H1N1. In 2014, we had an outbreak which was unusual for us. It's the first time that we were able to document Henipa virus infection here in the Philippines. Some disease threats that we had was in 2009, we had Ebola reston, which we found in pigs and a few people who were taking care of these pigs. We had the MERS virus incident in 2013, 2014. We had to contact trace a whole plane at that time when there was an OFW who came from the Middle East and visited briefly in the Philippines. And he was able to expose a lot of people in the airplane on his way to his hometown. You also had in 2014, 2015, the Ebola virus disease, something which is still persistent. No? It's still currently spreading in some parts of Africa. And of course, we had bird flu. We actually had bird flu. The first time we had it was documented in 2017. And just early this year in 2020, we had the H5N6 kind of bird flu. In the past years, we've had the WHO, the World Health Organization, declare yung public health emergencies of international concern, or the acronym is PHEIC. So, uh, ang ginagawa ng WHO is to notify countries who might have reported these kinds of emerging infectious diseases, and then alert the other member states as to how they should respond, how they should address issues in surveillance, in detection, in testing. So we're more prepared now than previously. Next slide, please. Yeah. This slide highlights the dynamic relationships between microorganisms, between human hosts, and the environment. It's parang adapted from yung what we call in public health yung epidemiologic triad. The three components of the triad are composed of many factors. Can you click on the slide again? So, yeah, for the human host, we have the susceptibility to infection. Knowing that COVID-19 is a new virus, it's a novel virus, so we don't have any kind of immunity or antibodies to it when it emerged. So it's an important component or factor. Second is yung human demographic behavior, how we behave in populations. Public health is really about how we look at groups of people in the community and as a whole and see how they can be affected. Another thing is because of globalization, trade and travel is now quite easy. So it's easy to spread disease unlike before. Fourth one is bioterrorism. Intentionally, people or groups might conceive of plans of uh, maybe spreading this virus intentionally. So it's something that's on our radar. We also have occupational exposures in the workplace, and we have this persistent problem about inappropriate antibiotic use. So in recent years, we had a stewardship program for antibiotics, and we should try to limit the use of antibiotics to those that can be prescribed by doctors. For the microbial agent, factors here include the genetic adaptation. As you know, COVID-19 virus seems to be very, very similar to the old coronavirus that caused SARS. And there is some variation. In this variation, I think it made it more transmissible and a bit more virulent compared to what we've seen in other coronaviruses. And there's also the tendency for us to have polymicrobial disease where we get infected by a lot of organisms, viruses, bacteria at the same time. For our environment, we have climate and changing ecosystems. We usually get to encroach in forest areas. These become farmlands. This happens in a lot of different countries, like in the Amazon, Brazil, and in many parts of Asia. Uh, Economic development and land use tends to make people live and thrive in communities where they are near possible areas where the emergence of diseases might occur. We also have technology and industry, poverty, social inequality, lack of public services, the fact that we have to live closely with domestic livestock. Um, it makes us more exposed to zoonotic infections. Because of war and famine, we also have um, a weakening further of our health systems. And basically, we have the lack of political will to change what needs to be changed. So all of these factors contribute to the components of the triad that leads us to the occurrence of emergence and reemergence of infections. Next slide, please. So this is a framework where we have different stages in the emergence of disease. What we had the past few months for COVID-19 is that there was an initial adaptation to a new host, being humans. And then there's this now stage of epidemicity or pathogenicity, where a lot of people are getting infected. So globally, we have millions already that are infected. And it has caused a lot of deaths. And here in the Philippines, we're still trying to get our data more accurately, more how do you say it? We get to test a lot of more people. In the coming months, in the coming 2 years, hopefully, the disease will be less pathogenic. It will be more. It will be a milder form of disease that leads us to a stage of endemicity, and later, eventually, we have a stage of full adaptation, where maybe the coronavirus will just be a commensal kind of organism. It won't really harm us. It might be beneficial in some way, but that will be later on as it further evolves. This is it that far away from yung nangyari sa H1N1. In H1N1, when it was in its epidemicity stage, it eventually became more mild, and then it became endemic. And up to now, I think H1N1 is still part of yung mga vaccine formulations natin. Next slide, please. I'll go to a discussion about surveillance. Um, Public health surveillance is a core function among public health professionals. It is the ongoing systematic collection and analysis and interpretation of data, and also the dissemination of that information. Can you click on the slide? An important component of surveillance is that it should lead to public health action. Next slide, please. A specific field of public health surveillance is disease surveillance. So we have competencies in surveillance, and these are geared towards providing data and information, also for the assessment of communities, or also for the design, conduct, monitoring, and evaluation of health programs. Disease surveillance help us discern actual evidence of trends or patterns of disease occurrence from those that are anecdotal reports, and fake news. We usually call those things as pseudo outbreaks or pseudo epidemics. What we do is we look at the rise and fall of the number of cases of diseases and deaths due to these different kinds of organisms. We obtain data from people and compare present disease occurrence with the past year or the past months or past weeks, or look at patterns of seasonality and geographic distribution. It really helps us dispel rumors and confirm rumors of outbreaks, whether these are rumors or not. This is the basis for our issuances of policy statements, advisories, and guidelines to all help provide guidance to the public. Next slide, please. Again, the primary objective for disease surveillance is monitoring health events. So number one is very clear, it's essential, yung detection of epidemics. Number two is when we try to look for secular trends, anything that does not look normal in our statistics, when when there are outliers or aberrations in how things are reported, that will alert us. And we can find cases in specific groups of people, try to investigate these groups of people. Number three is crucial. We also need to determine whether there is a rise in the number of incidents of cases and deaths in the general population or in specific high risk groups. It gives us an idea whether the virus is becoming more virulent, or it can lead to more deaths or complications. Number four, about healthcare practice. With our experience in COVID-19, if we find that cases are decreasing, does this mean that our public health measures are working? Public health measures like quarantine, containment, isolation, etc. If the number of deaths are decreasing, would that mean that patients are getting themselves managed earlier, and or are we getting the right kinds of treatments to our patients? So it's important for us to track down yung trends, whether nag-decrease na siya. So that can contribute dun sa yung konti ng deaths natin, reduce. The last one is a critical part of providing correct data, and how it can help us better protect those who are at high risk for complications or adverse health outcomes. So, tinitin natin yung mga high risk groups. Next slide, please. The other side of the coin, dun sa disease surveillance, highlights yung field of epidemiology. It's actually quite awesome. It's a very wonderful discipline. It's a field that has an applied aspect to it. If you are armed with all the skills of data gathering and analysis, we can also conduct investigations and initiate control measures to save people from the effects of these disease outbreaks. It also helps us in monitoring and evaluating our public health programs and try to find ways of preventing further outbreaks. It also helps generate hypotheses that can help fuel research endeavors. I'd just like to add that in our training in the government, in the Department of Health, our experience in the field, we have to be good risk communicators as well. We need to work with political leaders, with people in the community. We need to also address issues raised by the media and the public. And we owe a lot to the DOH Epidemiology Bureau. The Field Epidemiology Training Program also hones us to become good communicators. Next slide, please. So, what is the game plan for us? The control measures are quite straightforward. We want to prevent and control exposure from the disease, infection actually, and the disease itself. We want to prevent the spread, and also we want to prevent death. So it seems very easy, but it's quite hard to transition from the usual programmatic approach or perspective. I've been there in the past 20 years. Um, it's how to now have a systems approach, as Dr. Lester mentioned in his talk, that should make us more um, equipped to address disease prevention and control in the different aspects of our health system. Next slide, please. So when will it stop? An epidemic or outbreak stops when we exhaust the reservoir of infection. We get people treated, managed, or we try to find ways to isolate them from each other until mawala or reduce yung dami ng mga may sakit. We also need to cut chains of transmission and clusters of infections. So, andun yung sa interruption of transmission talaga. We make people stronger through herd immunity and mass immunization. And we want to modify the effect of the primary pathogen. So, we need to wait and see what the next moves are of the virus. Will it become less virulent or less transmissible, or the other way around? Will it become more virulent, or it can be easily transmitted from person to person still? Next slide, please. Sorry. One of the most fulfilling things that we've done for epidemiology is when we are able to track down the spread of a disease. In 2003, when we had the multi-country outbreak of SARS, health officials in Hong Kong, they were conducting an investigation, and they were able to trace the multi-country outbreak to a doctor who came from southern China and came over to Hong Kong and stayed in a hotel. The guests that were in that hotel also became infected, and they unknowingly went back to their countries with the SARS infection. Early during the outbreak, hospital workers and other patients in hospitals in Hong Kong and in other countries were also infected, as evidence was still mounting as to how the disease was being transmitted. Can you click on the slide? And another one. Yeah, during the Philippine SARS outbreak, there was a Philippine Canadian healthcare worker who was living in Toronto, and she inadvertently caused a chain of transmission in the Philippines among family members and health workers. The Filipino health worker apparently caught the infection from a family member of her housemate in Toronto. So all in all, we had a total of 14 probable SARS cases, 12 that were locally reported, and 2 that were diagnosed in the United Kingdom, but but they came to the Philippines early during the SARS outbreak. Yeah. So if you can see, there's a map where we did the contact tracing. The Filipina Canadian came from her travel, went to her hometown, and went to 4 cities, 4 provinces. This included Metro Manila, and we had to mobilize dozens of epidemiologists to track her down. It took us a week just to find this particular case. In the example of the contract tracing that was done for the SARS outbreak in Hong Kong, which was the source of the outbreaks in different countries, it took them many weeks to do this. Contact tracing is really hard work. Next slide, please. The SARS outbreak is the nearest experience we might compare to what we have now with COVID-19. It was then called a multi-country outbreak. They didn't have uh, set criteria yet for how you can call it a pandemic. It was only in the mid 2000s when we had bird flu and when we had H1N1 in 2009, 2010 that a declaration of a pandemic was um, uh, more specified. For the SARS outbreak, it lasted for about a year and a half, or half a year, sorry, in hotspot areas like Toronto and Taiwan, experienced a second peak or surge of cases. If you can see from this curve, there are a lot of peaks. Towards the middle part, we had a lot of disease outbreaks in different countries, and towards mid-April to late April, there was a second peak where we had a resurgence of cases in those two places, Toronto and in Taiwan. Next slide, please. So I'll be going to the next part of the talk, where we will present the pandemic response playbook. During the SARS outbreak, there was one barangay in Alcala, Pangasinan that had to be quarantined. Fortunately, there were no further cases identified other than those that were infected in the hospitals. After the last case was confirmed, it took us 2 incubation periods, or roughly 1 month, to declare the Philippines as SARS-free. LGU response was critical at that time, and our pandemic response playbook emphasizes that same critical role of the LGUs. This initiative is a collaboration between the PSPHP and 101 Health Research, and we are focusing our efforts on how to undertake data-driven community surveillance. We are basically proposing an innovative approach to combine rapid antibody testing and data-driven contact tracing. Next slide, please. Next slide, please. There has been a lot of talk about flattening the curve, and we really aim to have more granularity in the data that we have. So if we raise awareness about the kind of data that we should have in the local government units, this will give us more interest, be more curious how we can control the disease, and this leads us to calibrated response or action, much like what the purpose of surveillance is. Next slide, please. The term pandemic response playbook has these components. We gather data, we use network graph analytics or predictive analytics, and these can guide us in the implementation of response protocols. So we get data from the telcos or the use of mobile applications that are used for contact tracing, and we get test results from rapid testing or from PCR testing, and then we come up with a way to bring them all together in our network graph analytics. We do digital contact tracing and come up with prediction models and determine whether there are areas in our communities, in our local government units, where there might be a propensity or a tendency for an outbreak to occur. This will help us further hone or tweak our profiling and testing done in the community. It will lead us to a guided way of providing advisories on isolation and monitoring, which particular families or individuals should be quarantined and isolated and monitored for the duration of their illness. And if they will become severe cases, they will be referred for the necessary treatment in the hospitals. Next slide, please. The pandemic response playbook intends to widen the net of community disease surveillance through the synergy of having all these tools made available to the LGUs. So the playbook is actually a set of tools. We can do surveys for clinical symptoms. We can do rapid antibody testing in complementation with the RT-PCR tests, which are the gold standard. And we also have digital contact tracing, the graph analytics, to help us find individuals and areas in the community which need to be focused on. The ECQ is quite draconian. There are a lot of other areas that don't have this much infections, but they are also part of the ECQ guidelines, and we need to really come up with a granular way of looking for this area. So we have some strengths and limitations for each of these tools. It's not easy to implement them because there are some inherent difficulties, like for clinical assessments or surveys, these are prone to self-reporting and prone to recall bias. Antibody testing is nice, it's good, but may mga clinical caveats dito. The timing of this is crucial. We have no local data yet on its diagnostic performance, but we intend to validate this as these tests are being validated in other settings in other countries also. For the PCR, it's a gold standard, but it's very invasive and operator dependent. We need to have laboratories that are certified by the DOH for them to function as an adequate and effective PCR laboratory. We just like to mention that we are not actually competing with, these tests are not competing with each other. They measure different things, as the RT-PCR measures the amount of the virus in the individual, when the rapid antibody testing looks for the immunity or the antibodies. For digital contact tracing, it provides us a way to become more targeted in our approach. We will systematically identify people at risk for infection and look for the community spreaders. Traditional contact tracing is tedious, and we want to somehow come up with ideas on how to increase compliance. The good thing about analytics is that we can trace to secondary, tertiary level of chains of transmissions. So it's not just the first contact, but until we have a lot of chains of transmission. And we can use network centrality for us to predict who might be the one who will be causing the outbreak, or what areas will be the cause of the outbreak. Next slide, please. So the following slides highlight what we are all excited about, actually. These are just simulations. Our data scientist in the team, Mr. Wilson Chua, reached out to our group and shared how to use software that can be used to identify people who may be considered as super spreaders. These are highly mobile people with a lot of contacts in the community, maybe the workplace or in public areas. Once we identify these people, we can try to target who needs to be likely tested by virtue of their high degree of exposure to other people. So just one person can have connections to a lot of other people. Next slide, please. So our group is not involved in data collection. I just like to mention that. But instead, we intend to partner with the other third-party contact tracing application apps or platforms, their groups, and be able to help them render the analytics, especially on behalf of the local government units. Our collaboration will invest in capacity building for our health officials and other local officials. We will be able to make the analysis using the Neo4j software. Neo4j has a community edition that is freely downloadable. This slide shows the number of connections registered through the telco data, and it can help us identify members of the community who can be closely monitored because of their higher level of mobility. Next slide, please. The analysis also helps us to determine where a great number of connections are made. This kind of information on clustering is uh, vital, to identifying potential hotspots of transmission. If you remember what happened in Metro Manila, there were initial reports of cases that came from the Green Hill Shopping Center in San Juan. So it reflects somehow which areas where probably social distancing may not be observed strictly based on the number of connections. A key public health strategy is to prevent and control transmission. Next slide, please. So Sir Wilson Chua also provided us an idea of how this can be done, through heat maps to determine where clustering takes place in the community. Again, this is just a simulation. Next slide, please. If you remember the graph or the figure I showed regarding the chain of transmission during the SARS outbreak, it took us at least a week to trace all the contacts of just one person. In this figure, once a person is flagged as a probable or confirmed case in the system, we can try to identify the other people connected in the chain of transmission and alert them immediately. This can help us outpace the transmission of the virus to other branching chains from the main chain of transmission. So, prevent natin yung secondary chains of transmission. Next slide, please. This is a complex network of graph analysis of how things might actually be in terms of our connectedness. If one or more of these people are diagnosed as a probable or confirmed case, we need to mobilize an army of contact tracers. Sobrang daming taong kailangan natin dito to investigate all of these people And when we expose also the contact tracers, they might also become cases. So that's the difficulty of being a contact tracer too. There are comments now, ano, or parang criticism that we should not complicate matters with the use of contact tracing applications, as this will add another layer of complexity to our response. But we in our team, we see its true potential, and we will support the adoption of apps that are endorsed by the IATF and the NTF, the National Task Force. Now, I just like to mention again that we are not connected with any of these developers other than to coordinate in getting the data, and we will not benefit from the adoption of their technology. The new 4J software itself can be freely downloaded and used. Mr. Wilson Chua has already developed training materials on the use of Neo4j that can be used by the LGUs. Next slide, please. I'd like to close with just citing what happened in South Korea in 2015 during the MERS-CoV outbreak. In 2015, there was a 60-year-old South Korean national, sorry, who traveled from the Middle East and went to their country, and inadvertently he caused an outbreak that caused 186 cases and 36 deaths. Many hospitals were affected as the man visited a lot of health facilities, so nag-hospital hopping siya, trying to consult for his illness. It was unfortunate that it took the outbreak in South Korea to intensify its efforts, to prepare for another disease outbreak. Or maybe it's fortunate, no? At least they're now more prepared for what happened now in COVID-19. Next slide, please. I was a consultant at the DOH that time nung nangyari yung MERS outbreak in South Korea. And we were able to look at how the South Korean government posted in their website yung mga chains of transmissions with very, very granular data of how these occurred in the different hospitals. It also used the same network graph analytics that we are proposing now. We can maximize this data-driven contact tracing approach to limit the chains of transmission. From the examples that we have shown, from SARS in the multi-country outbreaks in the Philippines to MERS in South Korea, we can see how network graphs can be used. It's important to highlight that all of these contact tracing efforts take so much time, so much people and resources, and so much risk as well for the health personnel involved. Next slide, please. In South Korea, there was a joint mission from the government of South Korea and WHO, and they confirmed that the virus clustered around health facilities, fortunately, and there was no evidence that it was circulating in the communities. So, puro hospital-based ang kanilang infections. Kaya mas madali nila na control. The number of new cases has apparently tapered within weeks from the peak, indicating that the outbreak only had one wave. So if you notice, the epidemic curve tapers slowly in contrast to the initial surge of cases. Next slide, please. If we were able to have the tools to prevent these second wave cases, we should be able to maximize them. There are a number of contact tracing apps that are now available or in various stages of development or yung final rollout nila. The only app that is currently endorsed by the National Task Force is staysafe.ph, but the other apps are also being considered or at least being studied. These other apps can be downloaded or accessed from the Google Play Store. Just like to mention that the third one, the Novid software or app, uses not just Bluetooth but also ultrasonic technology. So it uses ultrasound, high pitched mga signals from your phone to come up with a mathematical way of judging the distance between people. So it's a more sensitive kind of technology for contact tracing. And the last slide, sorry, it took me some time. Implications for COVID-19 response. This is a call actually from our group and from all of us working in public health. We all need to converge at the level of the local government up to the level of the barangay. If we have any chance of transitioning from ECQ to GCQ, we should have the tools, the data, and the commitment to sustain these innovations to community surveillance. So we need to have location data, contact tracing apps, data-driven contact tracing and analytics, and testing. If we were to find a way to prioritize testing. We can't do really mass testing for everyone. We should have a focused, targeted way of testing. And if these are focused, especially in low resource settings, our public health actions can also be focused. So we have guidance for social distancing, movement restrictions, wearing of masks, quarantining and isolating those who are exposed or those who are cases, and refer for treatment those who are severe cases. So this kind of granularity is what we need and what we are proposing for the consideration of everyone. So I'd like to say thank you to our team from PSPHP and 101 Health Research. Sorry, it took me some time. I should have overtime ako, but thank you everyone, and back to you, Dean.
Yeah. Thank you very much, Dr. Choi, for that very comprehensive explanation. No? Dinala mo kami dun sa emerging infections in the past 30 years. That's a very good literature. And it's interesting kasi we can use that when we do policy foresight. No? But another important thing is on disease surveillance system. Dr. Choi is one of our epidemiologists. No? And themselves as disease detectives, right? So that's why they have this disease surveillance system. So with this surveillance system, it makes us more issues, and this is part of our data-driven approach to make a smarter and calibrated response. Okay, so maraming salamat. Our next speaker is parang nag-crash course tayo no sa medical school with our two experts from Philippine Society of Public Health Systems. So let's go naman dun sa local governments, this time application no, and operationalization of key concepts. So our next resource person is the local chief executive of the local government of Ormoc City, a product of UP Diliman and the UP Open University, where he once received recognition as an outstanding student in 1993. Friends, let's welcome Mayor Richard Gomez on public health best practices in Ormoc City. Good morning, Mayor.
Hi, good morning. Today I'm going to I'll give you a short presentation on confronting the present and facing our new normal. No? And what I'm going to present to you today are the things that we've been doing here at the local level since the state declared a state of pandemic. No, so I'm going to present to you enhancing surveillance and contact tracing in the LGUs through data-driven public health strategies. For almost 2 months of our fight against the worsening health crisis, up until this day, Ormoc remains COVID-free. And this is the reason why we're like transitioning to COVID preparedness. What I'm going to show you, I'll show you a timeline and the things that we've been doing here on the local level. Since March 9, when President Duterte declared the state of public emergency, and on March 11, when the World Health declared COVID-19 disease a pandemic, Ormoc City organized our own multi-agency COVID-19 task force. No? And in March 12, the LG of Ormoc organized an emergency response teams at the barangay level and established protocols in schools and offices. And on the following day, on March 13, we reduced working days for government workers to a 4-day week work system. The city established also border control points, and then we required health forms for individuals entering the city for contact tracing. On March 14, we set up a hotline intended for COVID-19 related reports. So one of the things that we did here first, we are actually the first LGU in the whole of Region 8 to close our borders, no, and declared a community quarantine and imposing very strict border control measures. And then I came up with an executive order prohibiting children 14 years and below and people 65 years old and above to just stay at home. Hindi na sila pwedeng lumabas ng bahay except for if they need to get their daily dose of sunlight. And then we closed down all our museums, all our tourism destinations. No, that was all closed. Ormoc City imposed several additional measures to ensure lessening the risk of transmission of COVID-19. Sometimes, well, even at the expense of economic activities in the city. So, mahirap talaga pag nag-close down ka sa mga businesses, border control. So, economic talaga yung tinatamaan, but that's really okay. What is important here is public health. No, we make sure that the people in Ormoc City are safe. Then, I want to show you also the things that we did as part of our best practices in the LGU. We set up our COVID-19 hotlines. We have our existing My Ormoc City app that's available on Android and iPhone app. We have our own website. Of course, Facebook pages, very important. And also our Instagram account. No, we use digital media as a means for efficient flow of information, both to and from the public, which would be critical in providing government response and services in any scenario. On March 15, all classes from all levels of public and private schools were suspended through an executive order. And also with an executive order, public curfew was imposed that starts at 10 up until 5 in the morning. Up to now, we're still on a public curfew. And then ambulances carrying patients with respiratory distress were not allowed to enter the city borders because of the fear of infecting people with COVID-19. No? And our LGU imposed a citywide community quarantine. On March 16, we suspended all sea trips, no, coming from Cebu. Cebu is just a 2-hour ride away from Ormoc, and as you know, Cebu is really badly hit now. And early on pa lang, we really had to close the ports. I convened also all the hospital administrators, the representatives, the doctors. We called on the Department of Health and the DALG regional personnel to discuss management and precautionary measures. I also called all barangay chairmen to establish, to organize standard protocols for COVID-19 response. And we're very strict with our local price coordinating council. Every day we make sure na prices in the markets do not go up. No, we make sure na yung price of basic commodities are stable. And then we also impose a very strict regulation in our public market. Vehicles were prohibited in some streets to enter. That way we can give more space to pedestrians walking, and so that we can practice proper social distancing. Parking, loading, and unloading are also regulated by men in uniform. No, tapos no mask, no entry is also imposed in the complex. A lot of civil society organizations have been helping us here in Ormoc City, especially in manning public places such as the market. No, and also on March 17, our COVID-19 task force reported our first count of PUIs at 11 cases and 739 PUMs. As we speak right now, our PUIs are down to just 6, no, and six of them are admitted in the hospital for investigation. 4 of them are isolated in their homes, and right now we only have 20 PUMs. Our on March 22, our environmental office, our general services division's office, and the League of Barangay initiated major housekeeping activities to prepare Ormoc City Hospital as an isolation facility in preparation for a worst case scenario of having an increased number of confirmed COVID-19 cases in the city. And on March 23, we were supposed to have our fiesta in June, but I asked the Fiesta Committee of 2020 Executive Committee to unanimously approve the cancellation of several, if not all, planned activities in the city. I regularly meet with different groups in Ormoc, no? The barangay LGUs, the micro, small, medium businesses, police and security is important also, the health sector, the labor and commerce sector, the agro-industrial companies, and the social civic organizations. I regularly meet with them so that we are always ready and prepared in case we need to mobilize right away, just in case we get hit with the COVID-19 disease. No, we also negotiated with businesses that's involved in production, trading, and distribution of essential commodities to seek a win-win solution that will also benefit the consuming public. Not a lot of people know that Ormoc is really this where we grow millions of chickens for food consumption. So as we speak right now, there's really an oversupply of chicken in Ormoc City. Before, chicken would cost about 120 per kilo. Now in Ormoc City, it's just 85 pesos per kilo in chicken. And mind you, the chickens now are really big. No, they're overfed because they have to be kept in their cages, and for because of late harvesting, lumaki na talaga sila. Some of the best practices that we've been doing here in Ormoc City since we started our lockdowns, that I asked sugar farmers to help us in disinfecting our public roads. As you can see in the slide, these are tractors owned by farmers in Ormoc City. The tractors that they use for fertilizers are what they use at night, no, to disinfect our roads using a water and chlorine solution. So I'm very thankful for the farmers who's been helping us every day since we started. No, there are five of them, five big tractors that spread at least 4 lanes of the spreaders, no, when they operate at night. I'm I'm very happy because the response of the private sector in Ormoc is really overwhelming. Uh, Several retail outlets offered food to frontliners. Some organizations donated PPEs for frontliners, for police, for people at the border control. Our local bus operators moved essential workers to their workplaces. A local bioethanol producer has been donating disinfectants and alcohols. Many offered whatever resources they have to help the government to carry out our goals in making Ormoc City COVID-19 free, and at the same time help us mitigate the negative impacts of the preventive measures. I'm showing you a picture of some of our established isolation areas at the barangay level. And to do that also, uh, I also came out with an executive order to the establishment and operation of barangay isolation units. I'm very thankful also to organizations like Chuchi Foundations. No, they've lent us 100 plastic beds. We've set up an isolation and quarantine area using the NHA housing in one of our barangays here. Actually, we're supposed to turn over this NHA housing this month, but because of the pandemic, we had to cancel the turnover. But instead, with what we did with the NHA housing is that we converted it first into an isolation area, just in case somebody will be affected. And we're also getting ready for the Balik Provincia program that the national government has initiated. And we call it a sa amin dito, we call that program is and it's like a repatriation program, no. Lahat ng papasok in Ormoc City, once we open our once we loosen up our borders, they'll have to be quarantined first for 14 days. So this is where they're going to stay. And we also created the ORMO COVID-19 contact tracing team through an executive order. Again, through an EO, I came up with guidelines on the management of human remains and burials in Ormoc City for the duration of a general or enhanced community quarantine. Sad to say, but this is not really a good time to go. No, there are no public viewings in funeral service centers. Wala. If you die in this time of COVID, within 12 hours, you have to be buried. No, at the maximum 24 hours. I asked our Sangguniang to come up with an ordinance requiring the wearing of face masks by all persons within the jurisdiction of Ormoc City during times of public health emergency when required by public health authorities, and providing penalties for violations thereof. And what I asked also from our Sangguniang, our Vice Mayor, is that to unify all our ordinances, no, that we are using here now for during this pandemic. That way, if in case we'll have hopefully not, in case we'll have another national emergency or pandemic, unified na lahat ng orders. I don't need to come up with another ordinance, or if a mayor in the future will experience the same thing, will no longer have to come up with new EOs, no. So kasama dyan yung curfew, restrictions of senior citizens and children going out their homes, yung isolation, staying at home, mandatory wearing of masks. Then medical staff will have to mandatory wear PPEs in ambulance services, etc. And then we also have hand washing facilities in our public markets and in all government offices and all government buildings. So that's mandatory. We set this up when we declared a pandemic, no. And then the new normal also for social distancing measures of public transportation or MOC. As you can see in the picture, may divider na yung mga tricycles. It'll divide, it'll put a division on the passengers in front, driver, and at the back seat, no. Of course, wearing of mask and the face shields, they may be quite expensive kasi on a regular basis or on a daily basis you have to change your mask. So not all tricycle drivers can afford to buy masks. So a lot of social civic groups in Ormoc have been donating to them, and we've continuously distributed information, educational and communication materials to people, and also are being posted at public installations. No, we're very thankful to organizations like Rotary Club and other organizations in Ormoc who's been very helpful to us. And then we also have a selective lockdown of sitios or barangays to ease the contact tracing. When we had a in one of our tests, no, tatlo yung nag-positive sa tatlong barangay in Barangay San Pablo, Barangay Borok, and Barangay Linao. Right there and then I told the police and the barangay tunnels to do a barangay lockdown. That way, while waiting for the confirmatory tests, I want to make sure na hindi kakalat yung spread ng COVID just in case it comes out positive. I'm happy to say that we already took down the border control of barangays San Pablo and Barangay Borok because after the confirmatory tests they tested negative. We're just waiting for tests coming from Barangay Linao, and that should come out today. I'm also hoping that the test will come out negative. No? For the social amelioration program of the DSWD, I was very strict in implementing social distancing, wearing face masks, and again, washing of hands as they entered our public establishments. I'm happy to say that the 23,000 people that received the amelioration in Ormoc City, it uh, took us 6 days to distribute all of that. And what's nice about the system that we did, bawat tao na papasok to receive their 5,000 amelioration from the DSWD, it only took them less than a minute. In fact, when I timed them, it, uh, it took us an average of about 50 seconds, no, for one person to receive their 5,000 pesos, to get their picture taken, and to leave the facility. So in Bisaya pa tawag na hapsay ang padagan sa among paghatag sa amelioration program. And also in Ormoc City, we're also the first to use a quarantine pass. No, since we're very strict in our borders, we're almost sure that there are very little people coming from outside. No, that are in Ormoc City. So we're able to open up small businesses. Our malls are open also, but not all of them are. Not all stores are open. You cannot enter facilities if you do not have a quarantine pass. We open businesses, but we also try to control the number of people coming out of their homes and staying out of their homes and by and going to the city. Uh, excuse me. We also implemented the market on wheels. So from Mondays to Saturdays, we have a market on wheels that go to the different barangays in Ormoc City, and you can see uh, they sell almost everything: vegetables, chicken, pork, fish. That way, we will limit the number of people going to our main market in Ormoc. Uh, there are a lot of challenges, no, in the time of COVID. Of course, availability of testing kits is a big challenge. No, there's really a delay in the distribution coming from the Department of Health, and also a delay on the test results.
50.40.
Region 8, we're in Region 8, but our tests will have to go to Cebu, which is in Region 7, and then we have to wait for days until lumabas yung test results namin. So that's why tagal. I also issued an executive order when I heard the president that his lockdown in Metro Manila will only be up until May 15. Honestly, I'm a bit skeptical and worried about the loosening of the quarantine in Metro Manila, considering that the number of infected people in Metro Manila or in Cebu has not gone down. So dito sa Ormoc City, I extended the quarantine up until May 30. And if Cebu will not flatten the curve and Metro Manila, I may have to extend our GCQ in Ormoc City. And some of the priority decisions and actions that I've done in Ormoc, we restored work, but we adapt modified work schedules. And then ginawa ko dito sa Ormoc City, we counted the number of houses all over Ormoc. So total to about almost 65,000 homes, no? What I did was yung pagbigay namin dito ng ayuda, it began first on the barangay level. All the barangay captains, all the barangay LGUs were tasked to give all homes rice and canned goods. And then a week and a half after that, we gave one house, one sack of rice. That was our program in Ormoc City. And it only took us 4 days to distribute 65,000 sacks of rice to all the 110 barangays in Ormoc City. But social distancing and wearing of masks shall continue. We open businesses in half capacity, and then our mobile markets will continue also. We designed ways for public transport to minimize passenger to passenger contact, and then we continue our task force meetings in partnership with our private sector here in Ormoc City. And what are our medium to long term plans? No, of course, we continue to work with national agencies, private sector groups to avail of schemes to restore the economy in Ormoc City. And then we created already a comprehensive database. We're about to implement our repatriation program for Ormoc residents. Yung part of the Balika Provincia program of the national government, although they don't have the implementing rules and regulations yet, but we already have ours in place. No? Once we begin that program, we have prepared isolation areas that can isolate 600 patients separately, and then slowly we'll open up our businesses in Ormoc. And as we open up businesses, we are also going to pilot test restaurants and prepare them for dine-in with social distancing. So those tables that can accommodate 4 people in one table, siguro after the dry run, maybe tingin ko, the table for 4 will only accommodate table for 2. So those tables that can accommodate 6 maybe will only accommodate table for 3 or table for 4. And then I encourage also all households in Ormoc City to do backyard gardening for food sustainability. No, and this is ongoing. I distributed vegetable seeds in all 110 barangays in Ormoc City. And in the picture in the slide, you can see na tumutubo na yung mga gulay nila sa bakuran. I always say na kapag meron kang tinanim, meron kang aanihin at meron kang kakainin, especially in this time of COVID-19. Ormoc City is a port city, and I called on all those LGUs that have passenger port operations, no, from Southern Leyte, Leyte province, and Biliran provinces. I called the LGUs from Hilongos, Bilyaba, Palumpon, Biliran, Maasin, Hindang, and other parts of Southern Leyte, Leyte, and Biliran provinces. Pinag-usapan namin dito what are the measures that we need to do in case Cebu will open up. Our biggest worry really in this part of Region 8 is Cebu City, because Cebu City is just facing us 2 hours away, no? And if they loosen up, tutuloy-tuloy ulit yung travel ng mga ships dito. So what do we do? What do we do with all the passengers coming from COVID-affected areas? So we've come up with measures, and pinag-usapan namin is that by the time they take the boat in Cebu, we've already determined their final destination. So if they'll be going from Cebu to Ormoc City, in case they're not going to Ormoc and they have to move to another LGU, the LGU themselves will have to provide transportation. That way, pagbaba nila ng pier, they don't have to go out of Ormoc and then iikot-ikot sila dun, magkakalat sila. No? From the port, they go straight to their service vehicles, and then they'll be sent to their final destination. And all those passengers will have to report truthfully their final destination. That way, the LGUs will be able to provide a transportation for them. Now, ang pinag-usapan din namin, if they will not be truthful dun sa reporting nila as they take the boat, kung sino yung may iwan sa pier, they'll have to go back to Cebu or dun sa initial destination nila, initial boarding area nila. And in my last slide, what are the support and assistances from the government and private sectors that's needed for pandemic preparedness, for prevention, mitigation, and recovery? From the government side, we need to continuously do testing. So testing kits should be readily available. More PPEs. We need to keep on. We need to set up our isolation centers, and for ventilators to be prepared, no, together with medical staff. Continued training of volunteers for healthcare facilities, and we need, of course, funding for private sector recovery. Now, for the private sector, it's important for them to be responsive, to have a responsive business solutions to avoid future infections. No? Investments on sanitation and hand washing facilities is very important as customers enter their facilities. It is also important to have proper reporting and compliance with existing laws and regulations. So, ladies and gentlemen, these are the these are the things that we do in Ormoc City. Thank you so much.
Dagang salamat, Mayor Richard, for your presentation.
May isa pa yan. Thank you, ma'am.
Kaayo ang imong presentation, no? Ang very evident dun sa presentation ni Mayor yung collaboration ng major stakeholders and also overwhelming ang support ng private sector. For example, yung pagman ng public markets and also yung mga donations. So really, yung private sector is important dun sa ating pag-response sa COVID-19. And also yung importansya ng digital communication. No? You initiated the Ormoc City application.
Yes, ma'am. And one of the things that I do here in Ormoc City is that a lot of a lot of companies and people are donating goods and funds, no. And I every time there's a disaster in Ormoc, I do not receive funds directly, but instead I ask for CSO civil society organizations to receive the donations for us. That way, people will see transparency, and that way they do not account me for holding money and spending it to things that are not needed. So at least maganda yung accountability, maganda yung transparency na ginagawa namin dito sa Ormoc when it comes to donations.
Yeah, that's right, Mayor, no? Yung governance principles talagang ina-apply niyo po sa city of Ormoc.
Yes,
so,
ma'am.
We'll get back to you, Mayor, for a few questions later on. Maraming salamat. Now, let's proceed to our observations and reactions by our panel of reactors. First, we have Dr. Maria Carson Capang Lopez, Center Escolar Las Piñas and DAP Academic Council. And we also have Dr. Michael Campuid, a health systems consultant, and Ms. Ana Bertha, dating Ginoo of the Center for Health Development, DOH, Mimaropa. Now, let's hear from Dr. Cuco Lopez for her observations and reactions. Ma'am, I'll give you 3 to 5 minutes po.
Okay. I'll comment for the 3 already all together.
Ma'am, can you fix your audio a bit?
It's already quite loud. Let me fix it. It's at full 100. Can you hear me now?
Okay, we will endure that kind of audio. Okay, ma'am, please proceed.
Okay.
I can't hear. Okay. Ma'am, we'll go back to you after Dr. Mike. I-phone in ko muna si Dr. Mike Campuid for his reaction.
Hi. Good morning. Can you hear me, Dean?
Yes, Dr. Mike.
Good morning. So thank you for all our presenters and really impressive array of speakers and also presentations. Just for my reaction, I think the merging point between the 3 speakers is the level of innovation that local governments within the Philippines could take in terms of response. So we saw from the presentation of Dr. Lester Heroy that he highlights that decentralization could allow LGUs to produce solutions way ahead, way ahead from the national government. And this is something that can have repercussions, but we can maximize the gains of this one. And from the presentation of Dr. Hepte, we understand that this is something that LGUs could take forth, the data-driven solutions for contact tracing. And from the presentation of Mayor Gomez, it was quite impressive for all the efforts that he has put into it, and then the understanding that his own team of within the LGU is his best way to calibrate his response within the LGU. So my question actually is for Mayor Gomez. Na malinaw doon sa mga binanggit niyo po, Mayor, na naghahanda na tayo pagbaba ng ECQ o kaya ng GCQ. Isa sa mga major challenges is changing the way that the city works. Ang tanong ko po, nandun na po ba sa horizon ninyo na baguhin ang CLUP, ang land use plan ng syudad, para yung development will actually now distribute the population so that you can ensure distancing? Yun po. And
Yes.
also hospitals.
Yes. Thank you, Doc Mike. Mayor, can you fix your audio? We can't hear you.
Yes, we just revised our CLUP and submitted it to the HLURB for approval. And in essence, it is actually already approved. We're just waiting for the certification from HLURB. I'm happy to say that well, not happy, but we accepted the challenge that eventually we'll have to open up and loosen up things in Ormoc City, and
Yeah.
we have to be very ready with what's coming to our area. But really, what we want to prevent is the infection of the COVID-19 that will come our way, and we're hoping that it will not. So
Yes.
as early as now, we're trying to do things that will prevent COVID from coming in and spreading. Siguro that's the reason why we're very strict with our border controls. We're very strict with social distancing, and I really ask our police, PNP, and the Philippine Army to be very visible, in our city, and to keep on telling people and reminding them the things that needs to be done. With regards to our CLUP, everything right now is not quite moving because of what's happening now. But once we get going, the CLUP is actually our Bible in the city to be used for our development.
Yeah.
That CLUP question of yours, Dr. Mike, is very important, no? Kasi we are looking at foresight, policy foresight. No? We're looking at the next 10
Yeah.
years, next 5 years, no? Kung ano yung plano natin.
Yes.
For that
So,
matter, yes.
yeah.
And siguro may
So,
discussion tayo saan. Yes.
Yes. So Dean, ayun po, just to probably these would be very good notes for Mayor Gomez later on. Kasi yung titingnan na natin ngayon, that the economy of every city will now shift towards more frontliners having a different type of salary rate. 'Di ba? Dahil fronts will have higher problems or higher bigger context to tread, and also halimbawa yung the way that the population within all your 110 barangays, gaano ka spread out ba siya o may concentration, kasi the higher the risk will actually parang doon tayo magbubuhos ng ilang mga mas marami sigurong mga ospital, admitting facilities. Yun po.
Yes.
Mga bagay na magandang pag-isipan. Pero maraming salamat po, inspiring work.
Thank you very much, Dr. Mike. Now let's proceed to our next reactor. May we hear from Dr. Kuko kung okay na ang audio ni ma'am?
Can you hear me now? Is it better?
Yes, you're loud and clear, ma'am. Perfect.
Okay. I was looking at the chat and there are many things that people would like to know, so I'll be very short. And I'll be focusing on management style and leadership, because I think many of the technicals they would want to be answered. Mayor Richard, isa pong kababayan nyo, taga Bulacan, magandang hapon po sa inyo.
Hello, ma'am.
Sa inyo. Oo, nainggit tuloy ako sa Ormoc, umuwi ka na, sir. No, but I went through what you shared. I did the day-to-day, from the 8 days and everything. And I realized that we were doing the process very, very planned, no? You started with organizing, you did planning, you came up with communicating, you implemented. So continuous yung implementation nyo. Nagkakaroon din po kayo ng reassessment in between. And then work for the buying in of critical sectors. Napaka-importante po, no? And marshalling support by your constituents. Ito po ba ay plinano nyo ng grupo? Kasi yun yung first day ninyo eh. If you look at your first day, you met with your group, right?
Yes. Yes, ma'am.
Doon po ba lumabas yung inyong mga plano na pag tiningnan po kasi, your responses are very fast and on target. So gusto ko pong makita ng iba na pwede palang gawin na talagang nauupo ka, nagplano ka, may proseso. Kasi po ang resulta, nakakainggit po yung inyong graph. Ito po yung tinatawag nating to die for na mga graph ng mga successful managers. So ang tanong ko po, yung proseso po ba ay inyong inupuan ng group ng first day?
Ma'am, when I became mayor in 2016, my kind of leadership was anchored on participative governance. No, so yung mga organizations sa Ormoc City, yung mga department heads namin, yung mga councilors, elected officials, I work closely with them. So when I make decisions, I always call on a conference and seek their knowledge. No, I seek their wisdom. And as a mayor, then from all of these meetings, from all these conferences, that is where I base my decision making. I'm one person who, as mayor, I listen to several people. That's why sometimes pag natapos yung trabaho ko, pagod na pagod po yung utak ko, no? Kakarinig sa kanila. But that's the way it is. Mayors should learn how to adapt and listen to people and use it as a tool in leading our city.
Ang susunod ko pong tanong is itong inyong how you attack the problem, no? Kasi pag tinitingnan ko yung objectives ninyo, nakita ko po yung isang pinakaagad ninyong ginawa ay ang major goal ninyo is to reduce contacts.
Yes, ma'am.
Yung po yung una nyong ginawa, hindi po ba? Pagkatapos po, sinuportahan po siya ng mga prevention of infection where contacts may happen.
Yes, ma'am.
Pwede na po kayo. At pagkatapos po, nag-ayos kayo ng facilities and services when infection occurs.
Actually, ma'am, it's not easy to come up with a decision of closing the borders, especially na yung Ormoc City is a business center in the region. No, kami ng Tacloban and Ormoc ang business center sa region namin. That's why when we close the border, alam nyo, sa totoo lang, marami talagang nagalit. Bakit ba kailangan pa isara yung mga borders? Siguro they did not see the foresight na the lesser people coming inside our city, the lesser yung chances na ma-infect yung mga tao dito. So if we are able to control our city with just the people living in our area, it will be much easier for us to control the infection, and it will be easier for us to do contact tracing just in case somebody gets affected by this COVID-19.
Maraming salamat, Mayor and Dr. Cuco. I'll get back to you later on pag may time pa po tayo. But
Thank you, ma'am.
yes, thank you for raising that question, no, on management and leadership stand, kasi na-flesh out natin yung participatory governance, no, the type of leadership ni Mayor Gomez. So now let's proceed to our next reactor. We have Miss Ana Berta, dating Ginoo. She's also our DAP faculty member, no, and she's from the Center for Health Development, DOH, Mimaropa. Ma'am Ana?
Good morning, Dean. Can you hear me?
Yes, ma'am. You're loud and clear.
Okay, I'll be very brief. My reaction will be like a reflection. Upon listening to our three speakers, you realize that what we're having right now in the COVID pandemic is a learning experience. We have discussed like three of the major critical pillars technically when we speak of COVID, contact tracing, surveillance, how important risk communication is. But I hope that what have been shared by the good mayor and the two doctors will be used later on as our learning points in identifying priorities, coming up with strategies, and then redirecting our resources. With the experience of our mock, I am very impressed with how until now they are still COVID-free. And I think there are four strengths that they have in Ormoc. One is foresight, which is data-driven, of course, as very evident in the presentation. Speed, solidarity, you can see the whole of government, the whole of systems approach, and the compliance of the community. And I would just like to end my reaction by three things. No, the surface sa sinabi ni Dr. Lester was the collaboration. Let us focus on the positive. Let us welcome new technology as presented by Dr. Hepte. And again, no, I'm a believer that leadership, as always, is the core of health system strengthening. And it is very evident here in Ormoc that, again, leadership is at its core in addressing this pandemic. Good morning, Din.
Good morning din at maraming salamat, Miss Ana. So very inspirational yung iyong response, no? First yung foresight, yung speed, no? Solidarity, and data-driven. So it's really about changing our mindsets. We need to adapt to the new normal. So this is really the key message, no? But at the end of the day, still leadership matters. So kailangan po natin talaga yan. Now let's proceed to our open forum. Madami pong tanong dito na lagay sa ating chat box. And una nating tanungin ay si Dr. Choi. No? Dr. Choi, what is the role of seroprevalence surveys for COVID-19? Should this be done at the national and local level?
Yes, thank you, Dean. Actually, Dean, in mid-March, WHO already provided some guidance on how studies for seroprevalence can be done in the community. So we're actually getting the ideas from their protocols of how either a cross-sectional study or maybe a series of cross-sectional studies can be done over time to see whether dumadami yung infections or lumalaki yung immunity natin. And if that happens, we have a more clear idea kung paano natin focus yung ating mga areas in the community where our public health measures need to be put up. Yeah.
Dr. Choi, follow-up question. Since efficient gathering of accurate data is so important, why does not the Philippines have a mobile-friendly data collection application that can be used during all kinds of pandemic responses?
Yeah, I think this is the first time kasi we've seen yung when we had our pandemic preparedness response, ito yung tinatawag silang stage 4 na talaga may person-to-person transmission in the community. We didn't have this kind of experience before. We only had yung a few cases like SARS, and we had yung threat of yung sa H1N1, which didn't really manifest as a very virulent type of disease. Marami kasi doon na hindi naman hospitalized eh. It was more of a mild viral disease, much like influenza na yung normal na seasonal influenza. So this time around, I hope that we can ramp up our capacities to develop more of these applications and see which one will be the best one to use in our local government units. Thank you, Dean.
Yes, thank you, Dr. Choi. Now let's proceed to Dr. Lester. My series of questions then for you. How is the current public health system in the country well coordinated, and how much is it protected from the whims of local politics?
Thank you for the question. Yeah, thank you, Dean Dizan, and thank you also for the speakers, Mayor Gomez, Dr. Troy, and the reactors. The questions mostly actually is coordination. In fact, when I was looking at the chat box, before I answer directly, siguro I go back to the three main points of decentralization, the reality of decentralization, people power, and the strong private sector, which makes coordination extremely difficult. When we were doing response to Yolanda, when we were doing response to Typhoon Sendong, Ondoy, and in fact, Mayor Gomez has shown that one of the early things na ginawa niya is coordination. And convening doctors, convening the private sector. So how? It's actually very difficult to describe. And as you can see, we have agencies like DOH and we have IATF. So in a way, DOH and IATF, IATF in particular is an interagency group that actually does its best to coordinate responses. It's improving. It's actually difficult to say if it's okay or not, but at least it takes time. That's why it also takes time and resources and skills actually to do it. At the local level, same. And Ormoc City has shown an example of how coordination can be done and can be done fast. And the role of leadership and also the role of local agencies. There is always a chance that mapupolitika ang lahat ng bagay. There is a good side to it and bad side to it. Many times hindi naman always good. Kaya the virtue of strong leadership and the importance of, as mentioned earlier, no, na listening and collaborative and being sensitive to the needs of the people. The challenge siguro for us who are not mayors, kasi hindi naman tayo lahat mayor, is actually how to support this and how to communicate with our leaders to ensure that, you know, we need to coordinate and to support that coordination. Yun lang siguro. Thank you.
Yes, another important point there is the collaboration, no, and the linkages. We have this LGU, academe, and community linkages. So we really have to promote and advocate that as well. Okay, for our three speakers, we have a question here. Okay, after May 15, do NCR need ECQ extension or ready to move to GCQ? Will GCQ further prevent the increase in COVID-19 infection? Pero sa ORMO kasi kay Mayor, hanggang May 30, no? Extended. So, can we hear from Dr. Lester muna, then Dr. Choi and Mayor Gomez?
Thank you. The way I understand it is the question is what happens after May 15, no? Do we continue ECQ or GCQ? And this is particularly for NCR, National Capital Region. This is personal and based on also on my observations on what's going on and coming from the advice of different experts. I have a strong feeling that ECQ will actually continue, although hopefully with some modifications. Sana kasi people need to work, and we all really are challenged by this. And hope I'm still looking forward na sana mag GCQ, no? But I will not be surprised actually if ECQ will continue. Sana lang na before that, even now, we continue to work hard to help our agencies, even private sector companies, our hospitals to prepare for that scenario. Na potentially a bit more extended ECQ or somewhere between a less stringent ECQ. So parang gradual restrictions of the gradual lifting of restrictions. Thank you.
Thank you. Thank you, Dr. Lester. Dr. Choi, may we hear from you?
Okay, thank you, Dean. It's a very interesting question kasi right now, ang iniisip natin kasi magka-transition na tayo to GCQ. Unfortunately, yung data that has been shown to show that mayroong flattening of the curve doesn't seem to have that much granularity. Again, yung term or yung word. We need to see whether our local government units are able to cope with yung dami ng mga kaso sa kanila. So, alam natin na hindi pare-pareho yung dami ng mga kaso across different LGUs, across different barangays, but we need to have it going, yung health system readiness natin at the level of the barangays. Hanggang kung matitrain natin siguro yung mga health workers natin and volunteers to be able to monitor yung mga movement sa mga tao in the community. Yung problem lang though is that we don't really have much leeway or much flexibility. I echo what Dr. Lester mentioned. That siguro kung mayroong mga adjustments tayo magagawa, they need to be proposed right now. And the Department of Health actually has come up with a department memorandum or an issuance that provides us public health standards for mitigating risk for COVID-19. So it gives specific guidance on yung social distancing, how to provide for yung mga protection, and also how to come up with a way to limit yung spread of infections. So these will need to be considered and hopefully adopted by the local government units. The key here is yung pagbaba from the national to the local. It's always been a problem but now the urgency is there, and I think kailangan talaga nating magpaspas talaga dun sa mga ginagawa natin. I'd like to commend Mayor Richard for the wonderful work that he's been doing in we'd like to partner with him and continue his accomplishments. Okay, thank you, Dean.
Thank you, Dr. Roy. Mayor Richard. Yes.
Yes. As a parting word, I'm really hoping that we can have an extended GCQ in COVID affected areas, especially in our area, our neighbor Cebu, no, we can see that the curve hasn't flattened yet, but in fact it is still rising. It is also very important for us here in the region to have a simplified and holistic approach. It's difficult for LGUs to just work on their own. It's important that the regional development council, the governors, and the mayors to sit down and come up with a single plan on how to come up with plans that will be lasting, no, up until we loosen up our GCQs. It is also very important for the community to follow, to listen, and to understand what the medical experts are saying, what the LGU is trying to do, and what we are trying to implement. If this will be followed, the chances of slowing down the rate of infection will be possible.
That's right, Mayor. No, we'll just extend for a few minutes. Meron lang tayong phone-in question from Dr. Carmen Peñalosa. She's not a medical doctor. Okay, Dr. Carmen is from the Center for Strategic Research, Miriam College. Dr. Carmen, are you there?
Yes, good morning, Lizanne. Very happy to be here. Good morning to all our speakers. I have two questions, but one very fast. We all know the importance of data-driven, evidence-based decision-making policy. Given that there is really a need for comprehensive data gathering, accurate processing of information, especially that we require real-time data, no, for monitoring and, of course, dissemination of information to the public. I wonder, Dr. Heroy, to what extent do we consider it important? I mean, if we look at it from the point of view of being transparent and being accountable for the accuracy of information. I'm asking these questions because we have heard recently from another webinar, a paper by Dr. Berse, a presentation, that we have had cases of misassigning of COVID cases, for example, in one city being assigned to another city, or for example, misreporting of a live person as a dead COVID patient, or for example, even misreporting of gender. Okay, I can imagine that such cases, especially on a large scale, if we're talking about national data and local government units working based on these data, would have tremendous implications on policymaking. How much of a concern would you say is that?
Thank you, Doc Carmen Peñalosa. I hope you can hear me. That's an important concern, the transparency, accountability, and accuracy of information. I will say a few words, but I'll also request Dr. Troy because a lot of it is information related. In UN systems, there's also usually when we do coordination, there's a group usually focused also on human rights, on these issues on inclusivity and disaggregation. And we usually have to make sure na importante yung accurate yun, as well as accountability, because disaster situations, including this one, can also be venues actually for human rights violations, or even just difficult non-transparent arrangements and so on. So these are very, very important issues, and governments, national government and local government, should also check this. And thank you also for raising this in this forum, so we can also try to see what is being done, or how do we counter check all this information.
Yes, thank you, Dr. Leroy. I believe, Doc Carmen, you still have another question? Sorry, we can't hear you. Kindly fix your audio.
Yes, Dr. Lizanne, thank you very much. Another, and this is for Mayor Gomez, congratulations. Very happy to hear that we have one LGU with such success. No, yeah, I'd like to just say that given how much comprehensive, very aggressive, I should say, proactive as well, working on worst scenario cases, I wonder what sort of challenges and issues you were able to encounter within Ormoc City, and within internal stakeholders, as well as external neighboring cities and national government agencies, considering the nature of the approach that you have taken on the issue. And related to that, of course, the challenges and the issues that you encountered, how did you handle that?
Well, one of the biggest challenges that I've encountered here is really financial. No, it entails a lot of resources to really come up with a very effective program, especially when it comes to running your own isolation center, running your own personnel, coming up with testing kits. Also, there's the speed of results from test from confirmatory test kits using the RT-PCR system is very slow because we do not have that here in the region yet. Ours was approved only just this week, no, and it's in Tacloban. Tacloban's about 2.5 to 3 hours away from Ormoc City. And right now, one of the bigger challenges we have is getting an accurate and quick results from coming from Cebu. One of the challenges that we also encountered in the local level is the DSWD. Kasi yung DSWD, pabago-bago yung guidelines sila. Sabi na, sige, bibigay mo yung social amelioration. O isama nyo lahat. Kailangan lahat, ha? And then so, kami naman, on the local level, it is our duty to come up with a list. And then sabihin na, the following day, when you start, sabihin na, kailangan isubmit nyo right away. So we submit. Natapos na namin, sabihin, tanggalin nyo muna yung 4-piece. Sige, tanggalin ho namin 4-piece. Kinabukasan, ibalik nyo ulit yung 4-piece. Tapos tanggalin nyo ulit. So, it's very different when you talk about getting data from more than 200,000 people. It's not easy. And then sabihin na, sige, isama nyo na yung mga isama nyo na pati yung mga yung mga barangay tanod. So gawa ka na, every time there's a new guideline, that means that's extra work on the local level. Mahirap talaga. So yeah, these are some of the challenges that we need to work with and adjust, no. Pero again, siguro ganun talaga on the local end. This is what I always say. I'm really hoping that on the national level, no, it's sana pag gumawa sila ng program, wag nila lahat binabato sa LGU yung funding, because not all LGUs are capable of funding all national programs. Kasi maraming mga lawmakers, maraming mga secretary, even on the executive level, sabihin nila, okay, we'll come up with a program, pero LGU na yung bahala magpondo niyan. Not all LGUs are as rich as Quezon City, Manila, Metro Manila cities. We have to understand that there are hundreds of 4th, 5th class municipalities na ang income nila runs only in the tens of millions, not in the billions like cities in Metro Manila. So the national government and on the national level, we have to be very, very careful in telling the LGUs na kayo na yung mag-implement at kayo na rin ang gumawa ng budget. That's really a big challenge.
Yes. Thank you, Mayor. We understand looking at governance perspective or lens, talagang meron tayong problem doon, no, sa national and local relationships natin. But maybe after this, we can do policy foresight para magkaroon tayo ng sound policy direction. Thank you, Dr. Carmen. Now, at this point in time, kaunti na lang, no? Let's acknowledge our colleague from Ateneo School of Government and the AP Graduate School, Dr. Lloyd Bautista, to synthesize the entire discussion. Very briefly, Doc Lloyd.
Very, very brief lang to. Well, we started by looking at the traditional functions and roles and models in public health system. And the difficulty right now is, are these traditional functions still working for us, considering the changes? This was discussed by Dr. Lester. And the discussion of Dr. Hepty looked at disruptive changes in our social, cultural, and political and economic environment. Many of the things that we're doing may not be working for us. This includes planning. This includes the way we undertake commerce, the way we educate. And these are going to disrupt in the coming months and perhaps even years to come. And he said that we need to do some systems thinking. We cannot isolate these problems individually. There is a connection with the entire ecosystem, climate change. And if you look at the history of COVID-19, it actually came with the way we destroy our environment. And Dr. Troy also looked at disease surveillance, and he kept on emphasizing granular data. Unfortunately, this is the lack of capacity of our local government units, with the exceptions of the cities like Ormoc and other big cities. We don't really have that capacity to do community-based monitoring systems. And the need for digital applications for contact tracing is something that is being promoted. But unfortunately, when I read some articles in the New York Times, I came across the fact that many consumers are hesitant in using digital applications for contact tracing. Mayor Gomez really emphasized the need for a community-based approach, which involves your business, civil society groups, and also the education. And Ormoc City can, after this pandemic, maybe we can look at Ormoc City as a best lessons learned and conduct a holistic case study. But aside from that, Mayor Gomez emphasized political will, which is important because he said that there are so many business groups also which got hurt with this some of the measures he took. And what we're missing a lot in this discussion is what Mayor Gomez said at the tail end. Dean, it's really about resources and funding. Many local government units, as what Mayor Gomez emphasized, do not really have that enough resources, support, and funding to be able to withstand another ECQ. And that is the dilemma that we're working right now. If we extend it, will some local government units survive? And that is really the puzzle that we have to look at. It's a balance between health and life itself, livelihood. So with that, thank you, Dean, and I hope I helped you.
Yes, thank you very much, Dr. Lloyd. At this point in time, we would like to hear a closing message from Dr. Eileen Espina. Thank you, Dr. Eileen, for organizing this. She is the executive director, or executive at large rather, of the World Organization of Family Doctors and Asia Pacific Regional Council. Dr. Eileen?
Thank you, Dean Lizan, and good noon to everyone. So with the indulgence of our resource persons and everyone in the chat room and those following us on Facebook and YouTube, allow me to close this session by saying that this pandemic is something unprecedented in our collective memory as a country. In the past, we have been spared from SARS, MERS-CoV, and Ebola. But this time, it seems we are not as lucky. COVID has reached our shores like a thief in the night, and it has spread like wildfire. Why did this happen? It happened because COVID is the perfect virus for a major pandemic. It has a low case fatality rate, a high level of infectivity, and a big percentage of asymptomatic carriers who are able to spread the virus fast, even before they manifest signs and symptoms of infection. The fast spread of the epidemic and the number of deaths in the country has also been sadly enabled by our overburdened healthcare system that has been hospital-centric all these years. This hospital centrism has resulted to a weak primary healthcare system and a low level of health literacy in our populace. These systemic issues was further compounded by the lack of trust in government systems or in government as a whole, and the proliferation of fake news or what we call as an infodemic. With this in mind, our group, the Philippine Society of Public Health Physicians, thus proposed this webinar to the Development Academy of the Philippines to enable us to share how public health and primary healthcare approaches were used in the past to win the battle against previous pandemics. Through the discussions and exchange of ideas today, we hope to awaken and remind everyone the significant role of public health and to emphasize the important role of empowered communities. We also would like to emphasize that the real frontline in this battle is the community, specifically the Filipino homes and the families. This approach worked very well with Ebola and other low and middle income countries. The efforts of government would not succeed without community engagement, participation, and support. We acknowledge, however, that it is a daunting task for LGUs to be given this difficult burden of creating an enabling environment that would foster trust and cooperation in the middle of a pandemic. We hope that through this session, through Mayor Richard Gomez, we were able to impart some useful information that other LGUs can apply. It cannot be further emphasized that it is truly effective leadership and good governance that can achieve community engagement. Local government units need to establish a culture of shared ownership so that our people would be able to trust the system, trust it enough to make them feel safe to use the contact tracing apps, self-report, and seek early care and attention through our BHERTs, and cooperate wholeheartedly with our health experts for their clinical care and management. We hope that today's session, we would be able to contribute to the co-creation of a nationally enabled, LGU-led, people-centered approach against COVID. We pray that this session would result in an enabling environment for engaged communities, empowered households, and healthy families in the coming days. I conclude by saying, together, we can win this war dahil COVID ka lang, Pilipino kami. Damo nga salamat and congratulations DAP, DILG, Mayor Gomez, the City of Ormoc, PSPA, and the Philippine Society of Public Health Physicians for this successful webinar. Mao pay nga kulop ha aton nga tanan. Thank you, Dean.
Thank you very much, Dr. Eileen. That was very inspirational and enlightening for all of us. No? So 2 words for me. We need to cooperate and we need discipline in our community to have a healthy community. So at this point in time, I would like to thank again our resource persons, our experts. Mayor Gomez, maraming salamat po. Dr. Heroy and Dr. Hepte, and to all our reactors, Dr. Lloyd, Dr. Kuko, Miss Anna, and of course, to all our participants, maraming salamat for staying with us. Nakatatlong webinars na po tayo. So up next, we'll have an international sharing of best practices. So we'll get mayors from an international community, then sa Philippines, we'll do comparative studies, no, and knowledge sharing. We'll keep you posted for that one. Okay, so to end up, kindly press your gallery view for a group photo session. That's how we end. We'll take a cue from Gerald. Kindly say 1, 2, 3, and then click. Okay, are we all in? Parang hindi lang tayo magkasya. Okay. Okay, I think ready. Gerald, are we okay? All right. So maraming salamat po sa inyong lahat. See you sa susunod na webinar natin. We'll keep you posted po sa schedule.
Thank you rin po.
Thank you, everyone.
Thank you.
Stay
Have
safe
a happy
po.
weekend.
Thank you very
Oh,
much.
stay safe, everyone.
Everyone.
Happy Mother's
Thank you po.
Thank you po. Happy Mother's Day.
Happy Mother's Day.
Happy Mother's Day.
Mother's Day.
Happy Mother's Day. Bye po.
Thank you. Birthday.
Thank you all.
Happy Mother's Day. Happy Mother's Day. What's that?
Yabang niyo pala eh.